Så, då ska vi köra igång livepodd med Equipodden här i SLUs monter. Jättekul att få vara här. Tack SLU att vi får komma hit. And we're actually doing this in English because our guest here today is Olga
Sajecka, very good.
We spoke about how I'm supposed to pronounce it before and it didn't really work, so...
Well, it's very challenging, as I'm actually not Swedish and I'm coming from Poland, so we have quite a challenging pronunciation. But you did a very good job.
Oh, thank you so much. And we are so excited to have you here today, and we are going to talk about your job as a veterinarian and as a researcher at SLU. And the topic of the day is like mare reproduction. So we have so much to talk about, and this is going to be such an exciting, learningful hour, I think. But we have to start from the beginning. Who are you and what are you doing for a living?
Yes, thank you. That's a good question to start with. Yes, I'm really excited. I'm really excited about mare reproduction. We can start with that. But to go back to the beginning, I'm a Polish veterinarian. I graduated from Warsaw University of Life Sciences, but already since being a student, I was really fascinated with equine reproduction. I somewhere heard that actually you can do embryo transfers in horses, so to collect the embryo from the mare's uterus and later transfer it to another mare. And I thought I need to see it. So this is how I ended up at the breeding farm of Polskie Mole in Gestut-Lewitz in Neustadt-Glewe, where I spent 3 following seasons, first as a student and later as a graduated veterinarian.
Oh, wow.
Some experience also as an Erasmus student, which I really recommend to all of the students, in Cordoba, in the University of Cordoba in Spain, also grounded me in this decision, as we had really, really interesting clinical practice in equine reproduction. This is how it started. So the work in Germany, where the farm was located, was quite intense with a really, really high caseload of around 100 to 200 cases seen daily, and delivering over thousands of foals. So it's been a really, really fantastic journey with amazing teachers who inspire you and explain you the basis. And at the end, this never-ending joy from seeing the successful outcomes of your work, which is pregnancy, is actually one of the best things of our work. I think that we have really measurable success in the pregnancies.
Of course, yes.
So after that, I followed my passion to it, and it was the next step was to take up on a new challenge, and that was coming to Sweden, where I got an offer of becoming a responsible veterinarian at a breeding farm in Sweden around Örebro. And that was another fascinating experience with learning everything about administration. Also, you can observe after working in different countries that the practices are actually different, the antibiotic use rules, the good practices, and also administration, the available semen doses, and so on, so on. So that was really interesting to see it from a different perspective. But at the same time, I was always drawn to research, and this is how I joined Swedish University of Agricultural Sciences. I reached out to the university, hoping to join the research effort. And that's how I am here.
Such an amazing journey, and to be like all over Europe. It must have been so fascinating to see, as you say, the difference in different cultures, in countries and so on.
I think it's a great experience, both as a veterinarian and as a human being. And that's how I recommend it to everybody else, to travel also for work, do the internships, learn different professional approaches, but also adapt to different teams. I think that's really, really a precious lesson.
Amazing. And how long have you been at SLU?
So it's, I think now I'm having the 2nd anniversary of working at SLU. So yes, I joined SLU at the beginning of 2023, I believe. So it's been quite a while, learning on how to navigate in the building, but also how to navigate between the teams. But I think that we have fantastic environment, and I'm really happy to join the celebrations of the 250 years of the faculty. Yes, I think that we managed to already deliver some interesting outcomes during these 2 years.
Amazing. And we're going to talk a bit about the practice, but I first want to ask you about your research. What research do you do and how is the research done for you?
Mm-hmm. So I'm really, really interested with equine reproductive physiology. So how does it actually is all coded? How does it all work? What is the mechanism of everything from the healthy cycle, the ovulation, and finally the pregnancy, how the pregnancy is kept for all this long time, and finally how the healthy foal is delivered. That's from the mare's perspective, which is probably the closest to my heart. But of course we cannot forget about the stallion and its very important effects in the whole reproductive process.
Very important, yeah.
Exactly. So I think I'm starting from this point, and I'm really interested in asking some questions. Okay, where something can go wrong, but also how does it actually work? Because there are still so many knowledge gaps that we are trying to fill. So one of the first projects that I was involved in was connected to anti-Mullerian hormone role in mare's reproduction. It's one of the hormones that is an inhibiting hormone, so it stops some processes. So our hypothesis is that it shouldn't be too low or it shouldn't be too high levels of this hormone, and we tried to investigate how does it work in the context of the breeding outcomes. I was also involved in a survey study that we did together with my really, really great master student, veterinary student. I would like to say hello to Kajsa on this occasion. You did super good job. And the results hopefully will be published soon. But the survey that we did was basically evaluating what vets in Sweden do. We have a similar survey that has been done in Germany, but no similar survey has been done anywhere else in the world. So we wanted to see, actually, to know where to start from, how to work with further with different problems in equine reproduction, what actually the vets do. And one of the biggest problems in the equine breeding is endometritis, which is the uterine inflammation. Maybe we can come back to that a little bit further in the conversation, but we asked several questions on how do you diagnose and how do you decide about the treatment of the endometritis. So I would be also very happy to come back to the results. I am also involved in the teaching of veterinary students, which I think it's a really, really great experience because it makes you really validate and organize your knowledge. So I think that's also really, really great experience.
Yes, teaching is very giving, and you have to really understand and how can I present my knowledge to someone else.
Yes, and the questions are not really yet shaped to what the books say or so. So I think that there's so much more creativity in these questions. I really like that. So often I say, actually, I do not know. Let's check that. Maybe that could be a fantastic research for your master thesis or even something bigger. So it's really, really interesting.
Amazing to hear. I think that we could start with like the basics, the practice of how to get a mare pregnant. Maybe we can start with how we do the starting points, what we look at, and all the way to deliver of a healthy foal.
I think that's a really good idea. What about imagining a real case scenario? We are at the breeding farm. I'm a veterinarian at the breeding farm, and I receive the mare. So what do we do? First, we usually start with the anamnesis. So we want to talk with the owner and take as many information as possible about the mare to know what is actually the story. It's also very important to identify your patient. You don't want to have the mare bred with the wrong stallion, and I think that's one of the most important parts of the job. But after that, we can already get a lot of information from the owner. And one of the first information that I want to know is, what is the plan for this season? Are we going to breed the mare with... So there are different ways of breeding the mares. We can either breed the mare naturally, so we can meet her with the stallion who will jump on the mare and this way deposit the semen. We can do artificial insemination, so collected semen dose, deposit in the mare's uterus in the appropriate time of the cycle. And here we have several options already.
Okay, yeah.
It's getting a bit complicated, but I will guide you through that. So the semen that we can obtain is in different forms. So you can either receive the fresh semen directly from the stallion that you might have at the place, at the breeding station that you work. This is probably the best case scenario for the quality of the semen. The more processes, the more time that the semen needs to travel through, the more difficulty for the sperm it is actually to survive and to keep its quality, right?
Yeah.
So we can get this fresh semen. Then the most popular in Sweden, I think, way of semen delivery would be actually transported cooled semen. So you can prepare the semen with the so-called semen extenders. It's a special mix of things that prolong the survival of the sperm. So all of the nutritive agents, antibiotics to prevent the development of the infections or development of the bacterial growth actually. So you can prepare the semen and store it in the cold temperatures, and this way you can send it around the whole country or even around Europe to transport the semen doses further in distance. So that's the second option.
Yes.
The third option, the last one that I would like to talk about, is frozen semen. So the stallions that are, for example, far away in the geographically, for example, somewhere else in Europe or in the world even, or stallions that are competing during the breeding season and are not available for the regular collection. The owners might be interested in freezing the semen and later in sending these frozen semen doses to the mares during the season. Also, of course, the stallions that already passed away, we still have frozen semen doses, which become very precious. Yes, they become very precious after that. We can also use this. So that would be another case. So after choosing the stallion, which is already, as you can see, quite a decision, and it will decide on the further process that me or other vets will have to uptake. So once we know how the semen processes or how the semen delivery will work, I will be able to plan my work accordingly. And the whole work is based on the mare's cycle. Mares, just like many other females, have hormonal reproductive cycle that will result in the repetitive ovulations. And after each ovulation, the uterus will be prepared for hopefully fertilization, production of the embryo, the pregnancy, and further receiving the pregnancy in the uterus and securing safe and good environment for the embryo to develop. So this cycle is repeated over and over again until the embryo ends up in the uterus and sends a signal. It's a chemical signal with all the hormones, and so it says, I'm here, don't start the new cycle, okay?
It's time.
Exactly. So in this case, when the mare is prepared for the ovulation, and she's so-called in estrus, I think it's the same in Swedish.
Yes.
So she has high estrogens, the follicles are growing, usually one dominant follicle is selected. In other species we have multiple ovulations. In horses it's rather rare. That's why we not often deal with twin pregnancies. So the follicle is growing, finally it's ready to ovulate, it breaks, the oocyte is released and it travels to the oviduct. In the place of this follicle we will have a new structure built. It's fantastic. This structure will produce progesterone, which you might have heard about this hormone. It's a hormone. It's a hormone of the pregnancy.
Yes.
It stops the new cycle.
Yes.
So if the oocyte meets the sperm, the fertilization is successful. The embryo will tell the whole body and the ovaries keep producing progesterone.
Yeah.
If there is no embryo to tell that, this corpus luteum that is producing progesterone will be induced to degenerate, luteolize, and then the new cycle will begin.
Yes.
It's fascinating.
Very fascinating, and so many things to. It's also amazing how the body can just do this, like on a regular basis. It's very impressive.
Yes, absolutely. We working with that on every day. We are still amazed with that. One more thing, if I can add,
of course,
is that actually mares, as you might know, they are in the reproductive competence time only in summer.
Yeah.
So there is additional regulation of the mare cycling and having these waves during summer, but in the winter, this activity is silent. There is nothing happening on the ovaries. So it's an additional natural way of the regulation of the mare cycle.
That's also so fascinating. That was actually my next question, because it's such a short period for the mare to get pregnant, and that can also be difficult for an owner if it doesn't really take. So we have had an insemination, for example, and it's successful, so we have created an embryo. What happens next in the pregnancy?
Yes. So I think that's really, really good point that you touched here with this especially short breeding season that we have in Sweden, and I think we will come back to it in the context of endometritis. But once we obtained the embryo, there are so many things that still need to be done.
Yes.
We can confirm the pregnancy in a mare at 14 days after ovulation. We know the time precisely thanks to the ultrasound examination, where we can see where the follicle was replaced with corpus luteum, the one producing progesterone. So we know precisely, and we usually do the first pregnancy check at 14 days when the embryo has around 1.5 centimeters.
Oh wow, so small.
It's tiny, and it's surrounded with a single layer of the cells and then the zona pellucida, and it already has it's soon producing this inner cell mass that will in the future be the baby. After that, still many things can happen, because at this time, embryo is still not fixed at any special place in the uterus. It will be still traveling around the uterus, which is very important in the whole process of the recognition of the pregnancy from the maternal side. After that, the implantation will happen. So the embryo will find its place and it will stay there, it will stop traveling, and it will start growing in this found place. Usually it's somewhere in the horn of the uterus. The uterus has 2 horns and the body, so usually it's in one of the horns. After that, we usually do the next pregnancy check around 26 days, when the embryo is implanted, but we can already see a heartbeat at 26 days.
It's amazing.
It's a really moving moment, I must say. After that, the embryonic development completes at 45 days, and the fetal development starts with all the formation of the placenta, endometrial caps, and all the hormonal changes happening at the same time. The pregnancy will last around 330 days, but in horses it's really, it changes a lot depending on the environment, depending individually on the mare. And there are some things that can happen on the way. We always want to make sure that the pregnancy is fit. Some things that we might be worried about is luteal insufficiency, which is when the corpus luteum is not producing enough of progesterone to keep the pregnancy.
Okay, yes.
That's one of the things that we could diagnose early in the pregnancy. Second most often problem that we would be concerned about is actually multiple pregnancies. We do not want them in horses. It's a high-risk pregnancy, and we should always reduce them to maximum single pregnancy. There are some other complications, but I will jump now to the later pregnancy, where some complications that we might be afraid of, and maybe that would be some valuable advices for the animal owners, is actually placentitis. So the fetus creates the placenta, which has a fundamental function in the survival of the foal. And some things can cause an inflammation of the placenta and therefore the decreased function of the placenta.
Okay, yeah.
And these are the cases where unfortunately we have some cases of abortions. And we can diagnose that, and in many cases we can try to treat that and extend the survival of the foal to hopefully deliver the healthy foal. And I think the first symptoms that the mare owner can see, I think that's what's most interesting
Yes.
for you, would be premature udder development. Usually the udder will develop and start filling with milk closer to the delivery. But if you see it much earlier than the predicted due term, then that might be a moment when you should consult your vet. Another thing that might be a bit worrying for you is discharge from the external genitalia, from the vulva of the mare. So then, if you have any worries, call the vet and do the pregnancy check again.
Sounds very good. And somewhere it's supposed to be a healthy foal coming out, and the mother can take care of it.
Yes, and that's a very, very moving moment. I think most of the breeders know that there is still such a long journey to actually having a healthy foal for the yearling sale or even for the first trainings. But that's for different specialists.
Exactly, that's a whole other conversation. I think that we should move on a bit, but before I move on, I'd just like to pick up this hormone cycle one more time. Because in us human, it affects our mood and our durability. You can be a bit tired. You can also have cramps. Is it the same for the horses?
I am unsure if the mares can actually feel the mood swings or the cramps as we do. I wouldn't dare to compare it this way, but for sure it affects the behavior of the mare. We can see differences in the mare's behavior during the cycle, and that's what most of the animal owners probably observe as well in some mares that are more expressive, because these heat signs of the mare, like sending a message to the stallion, hey, I'm ready to be bred. Yes. Look at all this beautiful perfume. Some mares are more expressive in showing that, and some mares, usually the cold-blooded mares, like Icelandic mares or some other ones, they are not this expressive. They will not show anything, and the only way to see if they are in heat is actually looking at the ovaries and the uterus with the ultrasound. So some mares can be less or more expressive in showing these heat signs. So we can see the signs in the mares standing next to the stallion, peeing a lot, stopping to pee, maybe sometimes being a little bit more aggressive, a little bit more destructive. So that might be observed. There are, if this is becoming a big burden for the animal owner, there are ways to manage that. There are different strategies. None of them is perfect, but they can be tailored to the case. So it is possible, and it does affect the mare's behavior.
Maybe that can be something to think about if you want to ride your horse or maybe compete during the summer. Maybe you should just have that in mind. What would you think that?
Yes, and also know your mare. I think it's
important.
It's very individual, but also it's very important that these signs can be also mistaken with some other problems, like behavioral problems, change of the environment, change of the herd, new horses in the herd, or simply pain symptoms that might be also expressed in a similar way to the heat behavior.
So interesting. I would just like to
Yes, thank you.
That's very interesting, and I think that it's very important to understand and just be observant, maybe.
Yes.
I would also like to ask, what can the mare owner do themselves to prepare the mare and to have the best groundwork for a healthy foal and pregnancy?
Mm-hmm. That is a good question. I would think of starting with selecting a good breeding mare. Of course, in the nature, the reproduction is mostly ruled by the evolutionary needs, but we select our mares based on the performance and the beauty that we want to obtain. So it's a little bit different, but we cannot forget that to obtain a healthy cycle, a healthy pregnancy and finally healthy foal, the mare needs to be fit for doing that. So of course the mare needs to first be free from any other ongoing diseases. She should be orthopedically sound to be able to carry this heavy foal in the future. She should have good body condition to have a healthy cycle.
A healthy cycle, yes.
Yes, exactly. So for sure, if the mare is too thin, you should investigate that first. Maybe investigate the case in the context of parasitology, looking for some worms, maybe adjusting the diet better. So that's one thing. The mare must be healthy otherwise. Reproduction-wise, we also want the reproductive tract to be fit. And the reproductive tract does two things. The uterus will be the environment for the pregnancy and the foal,
yes.
But later the vagina and the vulva will be some kind of first physical barrier for anything but from the outside world, the bacteria,
yes,
the viruses, exactly. All the dirt, not to enter the place where the embryo will be developing.
Yeah.
So we want the conformation of the reproductive tract to be correct. So you can look at the vulva of the mare, the external genitalias, and see if the conformation looks correct, if the labias are closing correctly, and basically fulfilling its function. Later, the veterinarian can also evaluate the cycle and the anatomy of the reproductive tract in the rectal palpation and ultrasound.
A lot of things to think about.
Yes. And I still haven't mentioned the infectious aspect. Of course, it's very important to always think about biosecurity when breeding and when keeping the horses.
Of course.
So it's also important to have the mare free from the infectious diseases.
Yes, I understand. And I think it's a very good point that you say the mare has to be fit to do the assignment that is coming, to have a little bit of muscle mass, to have good movement during the day and good feed and everything like that, of course, is also very important.
Yes, it's very important. The nutrition, but also the welfare, and that the mare is free from stress. The stress can also affect really the fertility outcomes.
As for everyone, stress is not very fun. I think that we should move on a bit in our conversation, and we are going into the topic that you really are interested in, and it's the endometriosis or the uterine inflammation. If I just say those words, can you explain first what does that mean, or what is that?
Mm-hmm. Yes. So I wanted to talk about endometritis. You mentioned endometriosis, and it's very good that you mentioned that because it's there is a condition like this as well, and I will get to that to explain how does it differ very gladly.
Perfect.
So endometritis is a condition of the uterine inflammation where the endometrium, which is the inner layer of the uterus, is inflamed. And actually it is normal that when after the breeding, after the deposition of all the sperm and maybe some dirt, some bacteria, all these foreign things for the uterine environment, we will have inflammation. Mm-hmm. And it's a physiological process that we want, because this means that all these inflammatory cells and the mechanical emptying of the uterus will help the uterus to clean itself after this process. The sperm can travel to the egg, but all the rest, all the dead sperm should be removed.
That's natural.
Right? Mm-hmm. So we actually want this process, but we don't want it to go out of control. We want it to be balanced. We want it to be not too high, but also to last maximum 48 hours, we say. Oh. And after this time, we assume that all these dirty things should be removed. If not, this process is continued as a pathological process, and this is where the veterinarians step in, and we try to diagnose it better to find good ways of the treatment. The problem is that further, this post-breeding induced endometritis can be complicated with bacteria, with fungi, with other infections. And further leads to, if they stay for much longer, they can lead to degenerative changes, fibrosis, angiopathy, so problems with the vessels. And this condition with the high fibrosis and the uterus losing its function actually is called endometriosis in horses.
And that's mostly in the first part of the pregnancy.
It's even before the pregnancy.
Yeah.
Yes. If we don't resolve this endometritis problem, we might have problems with obtaining the healthy or obtaining any pregnancy. So that's why actually endometritis is one of the biggest problems translating to the decreased pregnancy outcomes. I have looked at some data, and it seems that from all of the mares bred in the first cycle, only 50-60% becomes pregnant immediately. And then all the rest is being diagnosed further. Of course, it's nature. Sometimes something did not work, the timing was not good. We do not know. I like to say that it's where the science meets the mystery of nature. It's really fascinating.
Very nicely said.
Right? So we cannot always expect that it will work immediately. Sometimes it needs some time, better weather, or so many other components. But of course it might be also caused by endometritis and simply that the uterus is not healthy. And actually a little bit worrying data says that in this case the remaining 50-40% of the mares is more and more intensively and aggressively treated intrauterine. The treatment that we have available is cleaning the uterus mechanically with flush. So we can do intrauterine flush with help of agents that stimulate the contractions of the uterus. This is what the mare can actually sense as cramps, similar to the menstruation pain. But it helps to remove mechanically what is in the uterus. That's one thing. However, every time we pass the cervix of the uterus, we risk the infections. So it's more and more mares that are being treated. And also more and more of this receive antibiotic treatment. And this is very important in the context of growing antimicrobial resistance, because imagine the world in which we lack antibiotics to treat life-threatening diseases because of the rising antibiotic resistance. So that's why we actually thought of finding the best practices and alternatives for this antibiotic treatment. And we believe that the most important is prevention. And this is something that we can do, which is minding the hygiene of the work, emphasizing the importance of diagnosing the endometritis, not to treat when it's not needed. And I think here I would like to bring what you said before, that the season here in Sweden is very short. And that translates to much higher pressure on the mare becoming pregnant as fast as possible, especially in the context of the trotters business. The trotter owners want to have the foals as early in the year as possible, and we also do want that. But sometimes we really need to, I think, ground ourselves and think first, okay, what is the reason of the mare not being pregnant? Is it already the bacteria's infection and we do need to include the antibiotic treatment? Or there are some other reasons that we might solve without involving the antibiotics?
I think that's very important to highlight the pressure as well. And I can understand the pressure if you have a mare and you really want to, but you also have to listen to your veterinarian, right?
Yes, and yes, you should always listen to your veterinarian. But we are also human, and we also like to discuss different strategies. What I always do, I try to show pros and cons of some decisions. But of course, we all should be advocates for our own health, basically, and for limiting the antibiotic use, but also for the wise antibiotic use. I mean that sometimes it is needed, but we should wisely choose when.
Yes, really to have a conversation with your vet to see when the best time is.
Yes.
So you can do things to prevent, but if this happens, it will affect not to have a healthy foal or a pregnancy at all.
Exactly. Either most likely you will not obtain the pregnancy and the endometritis will be translated to decreased pregnancy results. Sometimes you can obtain pregnancies that will very fast die. Very often on the first pregnancy check you see that the pregnancy does not look well and the uterus obviously looks inflamed and not good. And this is not, in my opinion, it's not the best moment to actually treat the mare because it's not very thorough treatment and we have quite low chances of saving such a pregnancy.
Can it affect the mare in other ways? Does she get sick, or is it just the uterus? Or
That's also a very smart question, I think. In many other species, for example, like in dogs, or according to my best knowledge, also in women, endometritis is a process that is translated to the general health of the female. But in horses, it is not the case.
oh wow,
Yes.
interesting.
Yes, it is a very localized process, and usually you can have the mare going completely unseen of this signs of endometritis. We also deal a lot with subclinical endometritis, where with all the full gynecological check that we have available, it's difficult to clearly say that this is the case and what is the reason, and just lower pregnancy results can tell us about it, and maybe some cytology that we can take from the uterus. So it is very localized process. And on this occasion, I would like to maybe mention something else that we found interesting in our survey. I think I can mention that already, that it has been often misunderstood, endometritis, with another process that can happen after foaling. So after foaling, sometimes, for example, in the case that placenta was not fully delivered after delivery of the foal, or there was a dystocia complications, we can have a process called metritis, which is a process that affects all the layers of the uterus, unlike endometritis, when it affects only the endometrium, the most inner side, most inner layer of the uterus.
Yeah.
So we can have this metritis in the postpartum period that will very often translate into the general condition of the mare. These mares often get high fever, endotoxemia, sometimes laminitis, and this process, if not treated, might be lethal for the mare. So the mare might not survive that if not receiving appropriate help.
Okay.
And these are two different processes, not to mistake, both affecting the uterus. Metritis, after foaling, generalized condition. Endometritis, chronic condition, chronic or acute condition, but condition that will not translate into the general health of the mare.
Okay. That was very interesting. You would think that one part of the body being sick, it should affect everything, but very, very interesting.
Yes.
I would like to ask a bit more about the things that we can do. We mentioned to flush, and can you tell us a bit more about that process?
Yes, that's a very interesting question that many of the researchers and practitioners are asking themselves, and there is a lot of active research ongoing. So I think, again, the most important is prevention, so not allowing this process to take place, basically. So very good hygiene, wearing gloves, washing the mare properly around the insemination process, having the laboratories clean, also preparing the semen. With the semen, we introduce a lot of things, and of course the semen that is collected with the artificial vagina, it also will have all the bacteria that will probably on the penis. So it's also very important to maintain the hygiene of the stallion, and to prevent the development of these bacteria, we actually use antibiotics when extending the semen doses and sending it further. But there are already some alternative methods that I'm actually very proud to say that our professor Jane Morell from Swedish University of Agricultural Sciences has been working on. And it is a method that allows to separate the live, good quality semen from the seminal plasma, where all the bacteria are, and as well semen extender with antibiotics. How you do it? You place in the tube the colloid, special colloid, and over the colloid you place the semen with the extender. You spin it in the centrifuge, and later the good sperm will be at the bottom in the pellet, and all the rest will be above. The extenders and the bacteria will stay above the colloid. So it is a very good method to initially already decrease the bacterial load. So that's one of the ways to prevent the amount of bacteria and maybe the too big an inflammatory response.
Sounds like a cleaning process.
Yes, I think that's the idea behind it.
Amazing.
So that's one of the things that I find very interesting, and it's a simple process. So that's one of the things that maybe we could consider as well in the clinical practice. But going back to what we can do once we have it, yes. I'm sorry.
Yes.
So remembering about prevention, but once it happens, and after the ovulation, after the insemination, we can see on the ultrasound that the mare has a lot of inflammation still, some fluids maybe in the uterus. Then we can of course flush it and mechanically just rinse all the dirt. We can help her with some injections inducing the contractions of the uterus. But also there are some other non-antibiotic treatments that we can use, and I could mention many of them right now. The problem is that we do not have a lot of research done on the effectiveness, the exact protocols with what percentage to use, how often to rinse it after or not, and of course the side effects. So this is something that we will be working on. I can mention that we, as all the research community in equine reproduction. But what has been already proven to work well is, for example, ozone therapy. That's one of this. There are also some agents that have an effect on the so-called biofilm. So some of the bacteria, not only causing the problem, they can, over all of that, they can produce some kind of secretion that will cover themselves from antibiotics, and it's called biofilm. Yeah. And these bacteria can be 1,000 times more resistant to antibiotics simply because they are hidden from the antibiotic. So then we can also improve our antibiotic use with using the medicine that will break this biofilm. So that's another option. And there has been some research done on, for example, the use of the protein-rich platelet-rich. There has been some research done with use of platelet-rich plasma. It's the same that you use actually in orthopedic medicine. It has been found to actually decrease the inflammatory response of the uterus, so that has been done as well. There were ideas of using different substances, but this is still, I think, to be confirmed if it's safe to use. Another thing that we can also do is to diagnose mares prone for endometritis better. And we have some more futuristic methods for that, like, for example, PCR or genome sequencing. So actually finding exactly what kind of bacteria are, what kind of populations are in the uterus, and depending on the balance in the microbiome of the uterus, we might predict that some mares might be more prone to the endometritis and some might be less. So that's another tools for the diagnosis that are still being developed.
That one sounded very interesting, and also to really investigate what's going on, to see for every single mare, because everyone is different.
Yes. And for example, in human reproductive medicine, there is a very popular probiotic use. It's very interesting to think maybe we could develop something like this for mares. It might be challenging because also the microbiome, the uterus is not sterile, there are always some bacteria, but the microbiome also differs around the world, so we will see how does it develop, but maybe in the future we will have this tool.
Sounds very interesting to see, and that's also, of course, in like the science stage. I also have to ask, because everything you have said now has been like in the veterinary station or what the veterinarians do. Is there anything that you can do as the owner before or just after the insemination?
Yes. I think that something that you can do easily from my empirical experience is actually providing the mare possibility of movement. Movement improves the uterine clearance after the insemination. So I think that could be considered. Maybe you don't want to put the mare to the paddock for running with other mares immediately after insemination so that she won't expulse the precious semen dose that she has received. But after that, maybe after 4 hours or so, she could. That would be really good for her to move more and clear. To improve a little bit the pregnancy outcomes, we have observed that sometimes it's not research confirmed, but there are some theories that it's better to protect the mares from intense heat, for example, during the season. So maybe to leave them in a cool place, but like all of the mares, providing them their basic welfare of having the piece of a shadow, of course. And I think what owners can really do is the awareness, asking for good diagnostics, understanding the other side, and together striving for the best pregnancy success rate, but based on education, based on aware choices, and good diagnostics.
Very interesting, and I really like what you said, that movement is good. I can understand that you have done this insemination, maybe you are on your third try and you're very scared and like, oh, take care of my horse. It would be good to move.
Yes, absolutely, both for the head and for the uterus.
Yes. That's very, very interesting. Is there anything more we would like to talk about this topic?
I have a lot to tell you about the equine reproduction, but maybe that's for the whole. Maybe I could start a podcast on equine reproduction.
We can do a series with just reproduction.
Yes. Well, I think that the endometritis is already a big topic in itself, with a lot of effort from many, many researchers around the whole world. So I hope that we can all update you on some more solutions and more knowledge in the future. But reproduction is not only about that, and we are also developing more and more fascinating techniques of assisted reproduction. And maybe that's a good moment to actually say for the equine world that we have new methods of delivering equine embryos. So before it's been possible to produce embryos in the in vitro setting for different species. And for example, on the human example, in the fertility clinics, we have available several methods, like in vitro fertilization, where you place oocytes together with the sperm and they do the job. They do the fertilization, they create the blastocyst, and later you can transfer it to the uterus.
Yeah.
That was one option. Another option, for example, if we suspect the male infertility and problem with the sperm, for example, we could take the egg, one egg, and with the micro tools, catch one sperm and inject it directly into the egg. So we simply overcome the moment of the sperm having to get to the egg and go through the zona pellucida of the egg. It goes directly to the egg. And this is called intracellular sperm injection, ICSI. And this has been possible in human. In horses, however, ICSI worked quite well. It's challenging for several reasons, like, for example, collection of the oocyte in vitro. It's challenging. We can also not super stimulate the mare, so we cannot have too many follicles at once to collect because they grow only one follicle per cycle, right? So we have to collect some immature follicles, mature them in the in vitro setting, and further fertilize. So it's challenging with the mares for many reasons.
Complication.
And to make it more complicated, for unknown reasons till recently, IVF was not working in horses, but actually some groups in the past 1-2 years have published and have shown some working protocols with good blastocyst delivery rates for the in vitro fertilization in horses. So we will see how practical this process will be in the future and how much will it change the horse breeding industry with the use of assisted reproductive techniques. That's, I think, still to come, but it's coming.
That's amazing. That was actually my next point here, to have these transfer. We had a listener question about this, so it's very interesting to hear about this. But you would say that it's still quite on the research stage.
So there's, you mentioned embryo transfer. This is actually already used in practice.
Yes.
We can transfer the embryos that are produced in vitro. That's still, so IVF, I am unsure if it's used already commercially. It might be soon. It is already used commercially in some of the countries, not in Sweden. And then after producing this embryo, we need to transfer it to the uterus. However, we already have another method of collecting embryo produced in a mare. So we do normal insemination, and later we flush the embryo around a week after insemination, and transfer this embryo to another mare, the so-called recipient mare.
Yes.
So this embryo is not produced in vitro. It's produced by the mare with the transitional insemination, but it can be carried till the due term by another recipient mare. The challenge in that is that actually you have to have a mare at the same time of the cycle as the donor. So if you collect it on the day 7 from the donor mare, then you would like to transfer it to the mare of around the same time in the cycle. So that is logistically a bit more challenging. But it can actually overcome some problems that are from the side of the mare. For example, if the mare has a uterus that is unfit to carry the pregnancy and to develop further, in the case of endometriosis, for example, you could take this embryo and let it grow safely in the recipient mare. Of course, it is also used for the breeding of the, for example, sport mares that are used in the competition. If the mare should not be excluded from the competition, it might be tempting to flush the embryo and have the embryo from the same mare without losing the season for the sport.
That's very interesting. Also another topic in this big topic. So maybe we need to do another podcast just about that, because that's very debated at the moment. I know that our time is almost up, and I would like to thank you so much for having this talk with me and to be on the podcast.
Thank you so much for the invitation. It's been really, really nice to meet you. And I would just like to let you know, please, if you ever have some questions, feel free to reach out to us. We are always very happy to have any discussions.
That's wonderful to hear. Thank you so much.
Thank you.